everyone. My name is uh, Tanika Sitches Spruce, and I am a disability justice activist, also independent film producer and speaker, and I am also one of the co-executive producers of Divas in the City digital series and co-creator of the platform Divas in the City TV. And this is a special that I wanted to do today for Breast Cancer Awareness Month. There are so many women diagnosed with breast cancer, yearly. I know it's millions. And so I really wanted to have a conversation about what does that look like, breast cancer prevention, and also, the diagnosis and treatment. How does that look like? What does that look like for women with disabilities? A couple of weeks ago, we had a conversation around health and cervical cancer screenings. So today we're going to continue that conversation, particularly about breast cancer. And so today I have a very special guest with me today to have this discussion. This person is really near dear to my heart, a really great close friend of mine, a great advocate in the disability community, Jaime Junior. And so she will share for the first time, her metastatic breast cancer diagnosis, and also what every disabled woman and woman with chronic illness need to know about mammograms and breast cancer. So please sit back. You'll have a whole hour discussion. And then also you will hear from a doctor, Dr. Assad, at the end of this discussion, from Carmano's Institute, and a little bit of what you should know from a doctor's perspective when it comes to breast cancer and mammograms. And so without further ado, I would like to introduce and have here Jaime Junior. So Jaime, if you can share with us a little bit of who you are.
Okay, so I am a disability justice and economic justice advocate. I live in Detroit, Michigan. I'm the mom to one child, and since 2016, I have been very active as an advocate for health equity and anti-ableism culture.
Okay. Yes. And so if you can just, tell us a little bit about your disability and what it was like prior to your diagnosis, navigating with your disability.
So my disability is cerebral palsy, more specific, spastic triplegic cerebral palsy, where my right side is impacted. So navigating healthcare, first of all, as a Black woman, is always difficult because many times doctors have preconceived notions about your level of compliance, the level of pain that you can tolerate, and different things of that nature. Getting access to good quality care. And my disability as a person with cerebral palsy that primarily uses a wheelchair, it definitely complicates things because everywhere is not accessible. Unfortunately, people say, oh, we have the ADA, it should be, the ADA is the basement, and not everyone complies with even the bare minimum, particularly when doctors, if you have a family doctor, as I did, that I have been seeing for a long time. I haven't used a wheelchair my entire life, only for probably the last 8 years. So getting appointments, having to call and talk to the staff to find out if they're able to assist me, if I have to bring someone with me, if they have equipment necessary. I mean, even going to the eye doctor, I had to call and find out, was the room big enough for them to for me to go in with my wheelchair and an existing chair, and could they see me in my wheelchair? The same is true for going to see my primary doctor or any specialty physician. Mammograms, my first mammogram was not a fun experience for me. It felt rushed, it felt pushed. I felt like they weren't seeing everything. That's what I felt like. Because even though they tried to let me have the mammogram in a seated position, it really did not feel like everything was being seen. So that has always been a concern for me. Now, my second mammogram was completely different. I went to a different facility that the staff was more familiar. At least I felt like they were more familiar with assisting individuals with disabilities, particularly in wheelchairs. The machine came down to meet me in my lap, but I still feared that everything wasn't being seen, mainly because I have a right arm contracture and I can't lift my arm beyond this point here. So, like perpendicular to my head, I can't lift my arm. And if you have, if you're a larger busted woman or you have bust under your arms, that makes it difficult for the mammogram tech to see everything. It also makes it painful because you have to contort yourself in so many different ways, which is not fun. It's already stressful. Like being sick, period, is already stressful. But when you go into it understanding that the doctors and nurses don't think you're competent, right? They kind of treat you like a baby.
Yeah.
Or they don't want to listen to you. That makes it worse.
Yeah. See what you're saying. And so, what would be your advice just to people who have disabilities and chronic illnesses? Like, what would be your advice to them to go to the doctor? Is there anything they can say or do? Or, also, what should doctors know about, patients, dealing with patients with disabilities?
Well, as an advocate, and what I would recommend is if possible, contact the clinic or the healthcare provider in advance. See if you can talk to the office manager or even the doctor and let them know your concerns up front. Let them know your situation so that they can hopefully be honest enough to let you know that they can't set you there so that you can move on.
Yeah.
And in terms of what doctors should know that women with disabilities are just like any other women. We just do things a little bit differently. I'm a parent. I've been a parent for 26 years. navigating the healthcare system, not only for me, but for my son, was also stressful. Going to doctor's offices where I couldn't even fit in the room and close the door with myself, the aide, and my son. So really, they should know to be patient and know that everyone is an individual, right? If something may have worked for the last patient, ask first and don't just assume that that's going to work for me too.
Yeah, really, really like that advice. And I know when you talked about mammograms and getting those. So when did you start getting mammograms? At 40, or because I think that's the age that they say.
That's the age that you are supposed to get them. I actually had my first mammogram at 41 because I was a little afraid. I have a family history of breast cancer. My mom is a 35-year survivor. I have aunts and cousins. So that wasn't very responsible of me to put it off, but I did. So in 2022, I had my first mammogram, and that experience met my expectations. My expectations, first of all, were that it was going to be a horrible experience, and that experience met my expectations. After that, I got mammograms every year. The one thing that I wish that I had known then, that I know now, is to ask for an ultrasound. Ask for what I needed. You know, sometimes you trust doctors to know what's the right thing to do. Like I'm a professional. I'm a professional speaker. I'm a financial coach. I'm a tax preparer, and I expect my clients come to me because they feel like I know what I'm doing and that I have a certain amount of expertise and that I will make the right decisions that will work good for them.
Yeah.
And so I trust my medical providers the same way I expect for my clients to trust me. But through this experience, I have learned that it's not that simple. It's not that simple at all. The way they found my mass was through an emergency visit. I actually had a cold that lasted a little bit too long for me. And I was having trouble breathing, so I went to the emergency room. In the emergency room, they give you a CT, they take blood work, they do all of this stuff to make sure to evaluate, I guess, your condition. There, I felt like I was treated with the dignity, respect, and care that I deserved. I mean, when I first walked in the door, when I walked into the door of the facility, no sooner as I gave the receptionist my name, the nurse was there to take me in the back. The rooms were extremely large. They had enough staff to help me. It was a very welcoming experience. I wish that experience for everyone.
Yeah. So it's so as you said that it was due to emergency visit. So how did you become diagnosed with metastatic breast cancer?
Now that's a long and complicated story, but the short version is when the facility that I went to, they took a CT of my chest to check for blood clots in my lungs, because they thought maybe I had a pulmonary embolism. So when they did that, they found a lump. That day, they told me that the dye didn't go all the way in my arm. So they said, we recommend you do it again. So I went to urgent care within my hospital group. because my doctor was out on vacation. So I went to urgent care, met with a physician, and asked the physician to give me a referral to go to the emergency room to repeat the test. And I explained everything, all of the findings and the reasoning behind me wanting to go. So the next day I went again. We didn't have the same problem with the dye and went all the way through. And they found the same thing. They found this 3 centimeter lump. So fast forward through everything. I did not get diagnosed. I did not get an official diagnosis of breast cancer until June 26th, 2025. The lump was found on December 20th, 2024, and my official diagnosis date was June 26th, 2025. And at that time, I was informed that I had stage 3 breast cancer, actually. So at that point, it was treatable. And then a month later, they put you through screening, additional screening to complete your staging to make sure that everything is clear. So if they're going to do surgery, they can do surgery. If they have to do something else, they can take care of that. So by the time they were done with my staging assessments on July 10th, 11th, I was in stage 4 because it had spread at that point to 3 lymph nodes and my left hip. So I got diagnosed with stage 4 in July.
Yeah. I know that was definitely, a tough experience, and journey. So, what would be your, based on your experience, being, find out there's a lump in December, and, not till June, when they said stage 3, and then July was stage 4. So there's a wide gap. So, what would be your so what would be, why do you think that is? What took so long to receive the diagnosis? And then also, what would be your advice to women with disabilities, chronic illnesses, when you start recognizing that there's something going on, to advocate for yourself? Because what you experience, I know it's a lot of women have experienced that.
Yes. So the reason why it took so long for me is because my doctor, knowing my history, knowing my physical history, and then seeing the history of my mammograms where my breasts were dense, she actually requested, she referred me for MRI. And with the MRI or some tests, you have to get prior authorization. So they send a referral to another department. That department applies for the funding, and then you schedule the test. So I did all of that, and then the insurance denied that particular test, saying that there needed to be a test done before that. So I waited for my physician to get in touch with me to make other arrangements. I was already scared. I really didn't want to know what was going on. Being very transparent, I did not want to know what was going on. So I kind of took my time a little bit, but still in all, the doctor did not get back to me with alternative within a feasible amount of time. What actually happened was the hospital reached out to me in April to tell me that the physician had scheduled the wrong exam and that I needed to have what they call a diagnostic mammogram, which is a mammogram along with an ultrasound. So and then I called the hospital to schedule that test. Well, calling to schedule that test, I had to jump through the hoops of which facility could see me because I was in a wheelchair and I needed help transferring. They didn't know whether they could take me at the clinic or the hospital. It was a bunch of mess. And wound up, the only time that they could give me was in June. So the hospital didn't help me schedule the exam. Which I think would have made a big difference. It had the hospital help me go through that process, right? So what is the advice that I would give to a person in my similar situation? Advocate for yourself. Push, 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 push. When things are not happening within a timely manner, call a doctor and make a ruckus. Call them and say, hey, what's going on? They canceled my test, which I did reach out to the doctor and tell them that the clinic called and canceled my exam. So, but they never reached back out to me. And I should have really not only called, but I probably should have went there physically and, saying, I need help with this. I need intervention from someone else other than me.
Yeah.
To make this happen. We know our bodies and we know when something is not right. And if it don't feel right, tell the doctor. And don't stop telling the doctor until something happens. Call, go there, send a smoke signal. I don't care what you do, but get them to listen to you so that something can be done. What I learned through this process also is the idea of a diagnostic mammogram. Honestly, I didn't know there was such a thing. But when I had it, I thought to myself, now this makes so much sense. This is what they should have did with me from the beginning. By me using a wheelchair for mobility, there's only so much mobility I have in my body. For me, I know everybody is not me, but my trunk, I only have so much mobility in my trunk and I can't lift my arm. So I'm a large breasted woman and I have breasts tissue that goes up under my arm. So them doing the ultrasound as well as the mammogram actually is what identify everything, because the mammogram by itself really didn't pick it up. How I know that it really didn't pick it up is, so once the ultrasound tech went to the radiologist, and the radiologist came back and they said I needed a biopsy. So I went for a biopsy. So after a biopsy, they send you back for another mammogram. And when they send you for a mammogram, what they're trying to do, when they do a biopsy on your breast, they put these little metal clips in the area to signify that you had a biopsy in this area. So after they do that, they send you back for a mammogram, for the mammogram to take a picture of the area with the little metal stays in it. Well, when they did they couldn't get the metal stays in the picture.
Oh, man.
So what does that tell me? Thinking back, what does that tell me? What that tells me is my mammograms were incomplete from the beginning.
Yeah, because they couldn't get to.
Right. I never had a thorough and complete screening. So what I take from this is women, when you know you have accommodation needs, not only advocate for your needs to be met in the room, but search out alternative testing. I know that we shouldn't be the doctors. We should let the doctors be the
Yeah,
doctors. But it's important for us to know these things so that maybe we can suggest it to the doctor. Had I known there was a such thing as a diagnostic mammogram where they could take an ultrasound and see under my arm, I would have asked for that a long time ago.
yeah. And then what makes me like, wow, because if you have a history, a family history of that I would think that would should have made the doctors even more so. You get what I'm saying? You
Yeah,
know, to be like, no, she needs an ultrasound, or she needs the mammogram, the special, not special, but this is what she needs because
yeah,
of the family history. Because even with women who don't have disabilities, you take a genetic test and, if you have a family history, then, some women have double mastectomies and everything like that because they know there's a family history. So I would think that they would even be more concerned.
yeah.
Have you thought about that or like,
I have. I thought about that in great detail, and I'll tell you what I came up with from that experience. From really just thinking about that, kind of made me more upset
yeah,
because I'm thinking, was this a case of diagnostic overshadowing? Like they figure I'm a woman with a disability, maybe my quality of life is not that great. They don't want to put me through a whole bunch of extra stuff, but that extra stuff can save my life. If I had walked in your office, would you have given me the extra attention, right? Because it's right there on the paper. I fill out my family history every time. When I have a conversation with my doctors, I let them know that my mother is a 30 some odd year survivor of breast cancer, and that is prevalent. My dad had lung cancer. So I have cancer on, maternal and both. So, you know, I would have hoped that they would have taken more care with me. And I took my time and researched my doctor and looked for someone who specialized in women's health. One of the reasons that I did that is because since I've been using a wheelchair, I find it hard to find a gynecologist that can help me because I have extreme spasticity in my lower limbs. I really don't even have a center of gravity for you to put my legs in speculum to do something like that. So I thought getting a primary care physician that focused on women's health specifically would kind of bridge that gap.
yeah,
Um, but 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 it didn't. So that was disappointing to me. Um, And then I'll kind of blame myself a little bit because I said, well, if I had just went to a gynecologist, would the gynecologist, as opposed to the primary care physician, would the gynecologist have known to ask for the ultrasound? But I don't think that makes any difference. I think that as we put alerts in medical charts, you in the medical chart and say what you're allergic to.
exactly.
It tells if you have a deadly allergy when you go in there, they have to put all these bracelets on you. Why not have an alert that says accommodation needed so that when doctors and other healthcare providers interact with the person, they have some sense that additional care is needed. Additional attention is what I'll say.
Yeah,
Enhanced attention is required because you're right, it's not a special mammogram. It's called a screening it's an additional screening mammogram. I think, and I would love to advocate for and have lots of women around the world work together on this, that if women with disabilities or chronic illnesses should have an enhanced mammogram where not only they use the mammogram machine, but they also do an ultrasound, because that ultrasound is going to catch what the mammogram can't, right?
yeah,
I don't think it should be left up to the discretion of the radiology tech, the mammogram tech, the doctor to know if additional imaging is needed, because human beings are fallible.
yep, 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 yep. Yeah, definitely. And that makes me think about too another. 'Cause I just recently had my mammogram since I turned 40. I don't have any, history of breast cancer in my family. However, I know that they said, which I think they do with a lot of, young women, especially black women, I've heard, is that you have dense breasts. So just with the regular mammogram, if you have dense breasts, you're not gonna be may not be able to see everything. So, having, additional I think the letter did say that, we didn't find anything, but you do have this breast. So, if there's any concern, go for further screening, to ensure that there's no cancer there. But, just thinking of those additional measures, especially as you said, for physically disabled women, to have that ultrasound to make sure dense breast, make sure, though that's imperative. Yeah.
Yeah, yeah. And I got one of those dense breast letters just to think, going back and thinking about that. Yeah, it said you had dense breast and they call it fibroglandular tissue. So they found glands that were impeding, right? I mean, you have milk glands in your breast because that's what they're for. Going back thinking about that, my sister had the same instance. They found calcification, and her doctor sent her for a biopsy. It wasn't even cancer. It wasn't a lump. It was calcification that showed up on the mammogram, and they sent her for additional tests. If a woman has dense breasts, I think they should automatically get a screening, an additional screening, because right there it lets you know that they can't see anything. And how do they calculate this score? Because they give you this score, right?
Yeah.
And I want to say it's like 0 to 5 or something like that. And it goes backwards with 5 being okay. But now that you mentioned the letter, I'm going back, I'm thinking about the letter, and mine said I had a score of 5, no known family history, and no comparison. I had 2 mammograms back to back at the same place. How you don't have no comparison? In my chart, it says that I have a family history. So why isn't this information following me to the radiologist so that the radiologist knows And hey, you need to pay special attention to this person.
Yeah, yeah, yeah.
That's why I say we need to advocate for enhanced testing. And it may not even just be for women in wheelchairs or women with limited mobility. It may be for Black women in general because we tend to have denser breasts.
Mm-hmm. Yeah,
And these things can be missed.
exactly. Exactly, exactly. And so, that's something, a call to action, for everyone. And I will put up information, to where you can, where this is seen. Um, and or you could go on Divas in the City TV website. I think I'll put some information on there as well, so we can start advocating and know the signs and know what needs to be done and how can we come together to advocate, as you said, Jamie, for some additional screenings and tests and those type of things. So if we kind of go back to a little bit of how this came to be, is as we shared, dealing with bias. So how can we tackle that? Uh, what is your recommendations in dealing with bias or inaccessible, screenings, and things like that? What can we do about that?
So almost like platforms like this, hosting these kind of conversations are critical because if we reach our sisters and brothers, because men can get breast cancer too, actually.
Yeah.
But if we reach our comrades across the nation and they start asking questions of their individual positions, maybe that'll make them think. But also too, um, have the conversation with your physician. In medical schools, I think every medical school should have a program or a time where students are exposed to individuals with various disabilities. And I don't think just one kind of doctor, I think every kind of doctor should be exposed because we are not exempt from anything. We are the largest minority group in the world that you can join at the blink of an eye. So, and folks that have typical bodies should be joining with us because when it's good for us, it's good for everybody, I think.
Yeah, yeah, with the different testes and just with the general advocacy, if you show special care, and everything or awareness of the needs of people with disability per se, more so than special care, but and understanding the different accommodations that people need and advocating for that, that would be good. And I like what you said before. I'm just thinking another thing is accommodations should be in a person's chart. I believe University of Michigan does have that in their system, um, where if you have a disability or condition or whatever chronic condition, then you can say this is the accommodations and it stays in your chart. I'm not for certain of other hospital systems or medical systems have that.
I haven't run across it, and I've used 2 out of the 3 major systems here in the Metro Detroit area, and it's not in my portal for either one of the healthcare groups. Yeah, it really needs to be, and I think doctors too. Doctors talking to doctors, right?
Yes.
I went for a second opinion. Actually, I went for a third opinion, and I scheduled for a fourth opinion because I want to make sure that I am getting the best treatment possible. Because not only because I had such a difficult time with being diagnosed, I want to make sure that I am getting the correct treatment. Now, my physician has assured me that I am getting the most accurate protocol for someone in my circumstance, regardless of ability. The second physician that I talked to confirmed that. I'm waiting to have another opinion, and I'm sure it'll be the same thing. But I think we have to know our bodies. And if something is a little bit off, be concerned enough to have a conversation with someone, with your doctor. Like, this usually happens because for me, I didn't brush it off, but I have a condition where I get these I think it's called, I forget what it's called, but you get from deodorant, like your glands get swollen.
Yeah.
From wearing too much deodorant or the perfumey type of deodorant or whatever. So I'm prone to those, but this hurt a little bit more and it went on a little bit longer.
Yeah.
Yes. So, yeah. And also I'll say this last thing because I know we're running out of time. I think physician offices need to look like the general population of people that are going to see doctors. That means that doctors should have or not shy away from hiring individuals with disabilities to be a part of their practice, because not only does it show something to their patients, but it can help on the inside. Studies show that you are far less likely to discriminate against someone that you see as a colleague.
Yeah.
A friend. So having someone or clinic group that frame of reference will make sure that ability is at the forefront and that the education is there.
Yes. Yeah. I think that's really good. And there are doctors and nurses that do have disabilities, physical and or visible and invisible disabilities that I know of. So I think that is good, or even just part of the care team, when it comes to new diagnosis or whatever the case may be, to have somebody with a disability that can be called, to help support in the transition. Part of the care team is important. And before I let you go, I just, want to know, like, how are you feeling now with, the diagnosis? What type of treatment are you receiving? And, how are you dealing with it emotionally? So like navigating that.
So emotionally, it's a little bit taxing because as a woman with a pre-existing disability, I already kind of navigate the world from a different point of view. Yeah. I'm usually looking up people's noses anyway. Yeah. To try to add some humor, but this cancer diagnosis has definitely added a different layer of concern. Like, being in crowds is concerning to me. Every little twinge of pain makes me nervous now because I don't know what it is. The other thing is some of the medication, like, they replicate. I'm taking an inhibitor. I'm taking a hormone suppression. I'm taking medication to strengthen my bones, and um, and all of them have the same symptoms. All of them make you lethargic. They make you fatigued. They can make you dizzy. They can cause muscle and joint pain. And as a woman with cerebral palsy, I already have muscle and joint pain. I have pain. I can go back to childbirth. I remember the doctor telling me, ma'am, you've been having contractions and you dilated to 2 centimeters. This was when I was probably like 6 months pregnant. I was going into labor already. And the doctor's like, you can't feel that. I said, no. What's this supposed to feel like? She said, a period cramp. I said, what's that? She said, well, it starts in your lower back and it kind of goes into your groin area. I said, well, ma'am, I have that pain all the time. Is it intense? What does it feel like? So even from a physician standpoint, understanding the symptoms that a person already have as part of their chronic condition can, even in their mind, overshadow something else, right? Maybe the additional pain is not even occurring to me because I'm so used to dealing with it. It's not even on my mind. So, and it makes me nervous to move because I don't want to fall. I'm usually a daredevil, but now I'm really, really careful about transfers and about how I go about standing up. Because if I fall, I'm in a lot of trouble. So it has added an extra layer of stress for me just thinking about that. The economic impact has been horrific because I'm so tired and in a lot of pain. It's hard to return back to traditional work, like 9 to 5 work or even contract work sometimes, because I don't know how I'm gonna be feeling from day to day.
Yeah.
Today is a good day. I'm up. I've been moving around since about 7 o'clock this morning. So today is a good day. Some days are not. And that's where the emotional you have to. I know I'm probably like babbling a little bit, but
No.
you have to give yourself grace. That's the advice that I would give to someone dealing with chronic illness and disability or cancer. Give yourself grace. Allow yourself to grieve, however feels best for you. Because once you allow yourself to grieve, you free up your emotions to be able to sense other things that are going on in your body.
Yeah. Yeah, that's important, to grieve and give yourself space for that. Like you said, give yourself grace and have you like joined any support groups or talk to other people in similar circumstance or
So I'm a part of a support group on Facebook. I would like to go in person. I've told lots of folks in my village what's going on. And they hold me up on a regular basis. So they're really been my pillars holding me up now. But I know I need to join other groups. I really need to be in the company of people that are going through this. Maybe they're not going through it with a pre-existing disability, but they're going through it nonetheless. And maybe their experiences can shed some light on things that I can do to make it easier.
Yeah. I see what you're saying. It's always good to be in community and like it says, you got a great village around you. we love you very much. So, you know,
Yeah.
you're
Thank
back.
you so much. Thank
Yes,
you.
so
And,
important.
yeah, it's very important. And I can't let this time go by without really thanking you for sharing your platform and using it in this manner to bring attention to not only my story, but so many other stories that I'm sure are like mine that are in the background. And hopefully they see this and feel validated and that they're not alone.
Yes, yes, yes. Yeah, no problem. This is what we're here to have those conversations, and as it relates to women with disabilities and just disabilities in general, and Black women. We need this type of space. So before I let you go, I said that a couple times, that what would be your key takeaway for disabled women, chronically ill women, and then also with loved ones and advocates? How do you support
Um,
that going through this?
I think just give space for the person to feel their feelings, you know. Um, and for caregivers, this is what I'll say because I have wonderful siblings that help me and have always been there for me. Caregivers have to take care of themselves because if they don't take care of themselves, then we have no one to look out for us. So that's my advice. Take care of yourself and leave space for the ones in your life that are going through this to feel their feelings completely. Just validate them. Just say, okay.
Yeah, yeah, yeah. See what you're saying. Those are good advice. To for loved ones, and just give them space. And as you said, I know there's a lot of advances. As share with me, a lot of advances to you know, cancer in particular. And so if you could, share with the audience, as far as with the prognosis, and,
Um,
and cancer no longer for many people is and
not
many
a death
death
sentence.
sentence. So yes, give us hope.
Yeah. So the wonderful thing is that cancer is not a death sentence. Even metastatic breast cancer, they have so many treatments now. So many innovative things that they have. I know for my doctor, they told me that on average is 15, like 10 to 15 years for someone if they respond well to the medication, which definitely in my mom's day was not the case. Um, so that's good to know that I'll be around to buck my son for more years. Um, but yeah, yeah. And they even shared with me that they have patients that are well into their 70s. They have patients that they've inherited from other doctors. So the treatments are plentiful and they're being discovered every day. Something new is being discovered every day. Every day. So there definitely is hope and there definitely is a future for us, for those of us that are thriving with breast cancer. I'm not just surviving, I'm thriving because I'm here to tell my story. I'm here to call others to action to join with me to advocate for more enhanced testing.
Yes, yes, yes. It's more so like a chronic condition, cancer is. I know with yours in particular, is more of like a chronic illness with the medicine and things.
Yeah.
So, but yes, yes, yes. So thank you so much. So if people want to find you and have questions or, want to join you, where can people find you?
So I am on Facebook. I'm all over Facebook in 3 places. I'm at Jaime Junior. You can find me at Jaime Junior with my lovely picture. You can also find me at Black Girl Rolling, BLAQ GIRLROLLIN. That is the Facebook page. And also at Miss Wheelchair Michigan 2023. You can find me there. And I'm on Instagram at Jaime Junior 81.
All right. Thank you.